Dialogue should not be reserved for elites. We see in this time of health crisis the governor of New York and the president dialoguing to get the needs of the people of New York met. While all that is very nice, dialogue should not be reserved for elites. There are those in positions of power, Dick Cheney was one, who gave us our American Stasi, U.S. government gang stalking, to suppress ordinary Americans. No free speech, no participation in public dialogue for those who disagree with them was their mantra. Our American Stasi, first responders and neighborhood watch groups who mobbed citizens 24/7 for years, was born in a time of crisis like our own, 9/11. It is much harder in a time of heightened emotionalism to think. Yet think we must if we want to preserve what America is really supposed to be about, liberty. Authoritarianism is the enemy of liberty. It's a suppressor of free speech. It comes from a place of, this is how things are and you must accept them. It has been my experience that doctors in our medical profession frequently come from an authoritarian place. I have the knowledge and you need to listen to it and do as I say. Yet we all know knowledge is limited. We know there are individual differences, and that fact gets lost even in empirical studies. It is less lost in holistic medicine. Genuine dialogue seems more frequent in alternative medicine milieu, which is the one I'm most comfortable in. Right now we are told we must do what we can to prevent illness. Yet there is another way to look at it, and that is taking personal responsibility to do what we can to enhance health. When you talk about health, you automatically talk about good nutrition, getting sunlight, exercising, having a positive attitude. But things like that are not being discussed in our current crisis. We don't hear doctors explaining how our immune system works. We don't hear discussions about the difference in people who get the virus when exposed and those who don't. Now, in part, that is because doctors are focusing on how not to spread the disease. But aren't these also integral in stopping the spread? And what about research into the role of herbals and natural things that Big Pharma doesn't do research on because they can't make big bucks off it? Are there things Americans could be taking to ward off the coronavirus that they can buy off the shelf? Should research into such things not go on because there is no profit in Big Pharma in it? When reports of such things as working are brought forth, it is dismissed by our medical community as anecdotal. While the authoritativeness of our experts right now is very valuable here in America, even in these times of heightened emotionalism, especially in view of the disruption the current way of attacking the coronavirus is taking, we need to make sure dialogue is taking place between all parts of our community. That includes hearing the voices of holistic practitioners. It includes questioning how creating food scarcities by engendering panic helps the cause of our health. While liberty in a pandemic doesn't mean acting contrary to the lawful pronouncements of public officials, it does require the exercise of free speech and open dialogue and not using the public airwaves to give only one point of view. There is science-based studies with groups, and there are individual exceptions, and both the study of results in groups and an emphasis on not losing awareness of the individual, their unique responses, and liberty is important. Programs of suppression, like U.S. government gang stalking, which began after 9/11, have no place in a so-called free country. My website is www.stopgangstalkingpolice.com.